Space medicine is a specialized branch of medicine that focuses on the health and well-being of astronauts during spaceflight missions and their adaptation to the space environment. It encompasses the study of the physiological and psychological effects of space travel on the human body, as well as the development of medical interventions, countermeasures, and healthcare systems to support astronauts' health and performance in space. Space medicine addresses a wide range of health challenges associated with spaceflight, including microgravity effects. Prolonged exposure to microgravity during spaceflight can lead to musculoskeletal deconditioning, cardiovascular deconditioning, fluid shifts, bone loss, and impaired immune function. Space medicine researchers study these physiological changes and develop countermeasures, such as exercise protocols, resistive training devices, and dietary supplements, to mitigate the negative effects of microgravity on astronaut health. Space radiation. Astronauts are exposed to higher levels of radiation in space than on Earth, including solar and cosmic radiation, which can increase the risk of cancer, cataracts, cardiovascular disease, and other radiation-related health issues. Space medicine research aims to understand the biological effects of space radiation and develop shielding materials, radiation monitoring devices, and medical countermeasures to protect astronauts from radiation exposure during space missions. Psychological stress. Spaceflight can induce psychological stress, isolation, confinement, and interpersonal conflicts among crew members, leading to mood disturbances, anxiety, depression, and impaired cognitive performance. Space medicine researchers study the psychological effects of space travel and develop behavioral interventions, psychosocial support systems, and team-building exercises to promote mental health and resilience in astronauts. Medical emergencies. Space missions pose risks of medical emergencies, injuries, and illnesses that require prompt diagnosis, treatment, and medical intervention in a confined and resource-limited environment. Space medicine practitioners develop medical protocols, emergency response procedures, and onboard medical kits equipped with diagnostic tools, medications, and medical equipment to address medical emergencies and provide medical care to astronauts during space missions. Environmental factors. The space environment presents unique challenges to human health, including temperature extremes, microgravity-induced fluid shifts, atmospheric contaminants, and microbial contamination. Space medicine researchers develop environmental monitoring systems, life support systems, and spacecraft hygiene protocols to maintain a safe and healthy living environment for astronauts and prevent environmental hazards in space habitats and spacecraft. To address these health challenges in space, space medicine researchers employ a multidisciplinary approach that integrates medical science, physiology, psychology, biomedical engineering, pharmacology, and space life sciences. Key research areas and countermeasures in space medicine include exercise physiology, developing exercise protocols, resistance training devices, and treadmill systems to counteract musculoskeletal and cardiovascular deconditioning in microgravity and maintain astronauts' physical fitness and bone health during space missions. Nutritional science, designing balanced diets, nutritional supplements, and food packaging technologies to meet astronauts' dietary requirements, prevent nutritional deficiencies, and ensure food safety and quality in space environments. Telemedicine and remote healthcare, implementing telemedicine technologies, medical imaging systems, and telecommunication networks to enable real-time monitoring, diagnosis, and treatment of medical conditions in space and provide remote medical support from ground-based medical experts. Behavioral health, conducting psychological assessments, stress management training, and psychosocial support programs to promote mental health, resilience, and team cohesion among astronauts during space missions. Medical technology, developing medical devices, diagnostic tools, imaging systems, and minimally invasive surgical techniques adapted for use in space environments to facilitate medical care, diagnosis, and treatment of injuries and illnesses in astronauts. By advancing research in space medicine and implementing evidence-based medical interventions and countermeasures, space agencies and healthcare professionals can optimize astronaut health and performance, enhance mission success, and ensure the safety and well-being of crew members during space exploration missions to the Moon, Mars, and beyond. Space medicine research not only benefits astronauts but also contributes to medical knowledge, technology development, and healthcare innovations that benefit terrestrial medicine and public health on Earth.